Every day, your body sends you a silent report. Most people flush it away without looking. What if that one glance could reveal something critically important about your health right now? Your urine holds clues about your kidneys, liver, hydration, and even serious diseases inside your body. Today, we decode every urine color and what each one means for your overall health. Welcome to Real Health Logic, your source for evidence-based health insights. Let's get straight into it. Your kidneys filter your blood constantly. Everything they remove ends up leaving your body as urine. Think of urine as a liquid report your kidneys produce after processing everything inside your bloodstream. Dr. Keith Badani, Vice Chair of Urology at Mount Sinai, explains this in a simple way. He says urine works like a thermometer for the body, showing what is happening deep inside. It does not measure temperature. Instead, it reflects your fluid levels, organ health, and internal balance. The yellow color in urine comes from a natural compound your kidneys excrete called urobilin. Urobilin is also known as urochrome. It is always present in your urine in some amount. The more water you drink, the more diluted urobilin becomes, and the lighter your urine looks. This is why hydration directly controls the color you see every time you visit the bathroom. Now let us start with the healthiest color you want to see in your toilet bowl. Pale yellow, or straw-colored urine is the best sign that your body is properly hydrated today. It means your kidneys are filtering efficiently, and your fluid intake is sitting at a healthy level. If your urine looks like pale lemonade or light straw, your body is in a good place. You do not need to change anything when you consistently see that light, transparent yellow color. Many people think completely clear urine means they are perfectly healthy and drinking enough water daily. However, completely clear urine actually means you may be drinking more water than your body truly needs. Overhydration is rare but real. Drinking excessive water can dangerously dilute your body's sodium levels quickly. This condition is called hyponatremia, and it can cause headaches, nausea, confusion, and in severe cases, death. So if your urine looks like plain water consistently, it is safe to slightly reduce your intake. The goal is always that pale yellow zone, not completely colorless and not dark or concentrated yellow. Now let us move to a color that signals your body is beginning to struggle with dehydration. Dark yellow urine, the color of honey or amber, means your kidneys are conserving water aggressively now. When you are dehydrated, your body sends a signal telling the kidneys to pull water back inside. The kidneys reabsorb that water directly into your bloodstream, leaving behind a much more concentrated urine liquid. That concentrated urine has far less water and far more dissolved waste, proteins, and natural electrolytes in it. The result is that darker, stronger yellow shade that tells you to drink more fluids immediately. This is your body's early warning system working exactly as it was designed to work for you. Other signs that often appear alongside dark yellow urine include fatigue, bad breath, and muscle cramps. You may also experience sugar cravings and feel unusually cold or tired throughout the day as well. Doctors generally recommend drinking 1.5 to 2 liters of water every single day minimum. That is in addition to other fluids like tea, juice, soups, and water-rich fruits and vegetables. If increasing water intake does not improve your urine color, schedule an appointment with your doctor soon. Keep in mind that certain medications can also darken your urine to a yellow or orange shade. Phenazopyridine, a medication for urinary tract infection pain, is a well-known cause of orange-colored urine. Sulfasalazine, used for treating ulcerative colitis, is another medication that can shift your urine toward orange tones. Always check your medication side effects before assuming a color change is related to your hydration alone. Now let us talk about a color that should genuinely concern you and prompt you to act fast. Brown urine, the color of black tea, dark cola, or brown ale, is a serious warning signal. At this stage, your body has moved well beyond ordinary dehydration into a much more dangerous territory. your kidneys are under severe stress, and the risk of real organ damage becomes very significant now. Brown urine can sometimes have a simple explanation, like recently eating rhubarb, fava beans, or aloe plants. These foods contain natural compounds that can temporarily shift urine color toward a darker brownish shade temporarily. Some antibiotics and certain laxatives can also make your urine appear brown for a short period. However, when diet and medication are not responsible, brown urine can point to something far more serious. One dangerous possibility is rhabdomyolysis, a condition where muscle tissue breaks down rapidly inside your body. This breakdown releases large amounts of protein directly into your bloodstream, which then overwhelms your kidneys badly. Symptoms alongside brown urine include severe muscle pain, extreme weakness, and feeling completely exhausted after physical activity. This condition requires immediate medical attention because untreated rhabdomyolysis can lead to acute kidney failure very quickly. Another serious cause of brown urine involves your liver, one of the most vital organs in your body. When the liver is not functioning properly, excess bilirubin builds up and spills directly into your urine. Bilirubin is a pigmented component of bile. When elevated in urine, it creates that darker brownish color. This can signal liver disease, hepatitis, cirrhosis, or blockages in the bile ducts within your body. Additionally, people with a personal history of melanoma should pay very close attention to brown-tinged urine. Brown urine in melanoma patients can indicate that the cancer is actively progressing inside the body now. If you are regularly seeing brown urine without a clear dietary reason, please see a doctor promptly. Do not wait and monitor it. Brown urine with no obvious cause always deserves professional medical evaluation immediately. Now let us talk about pink or red urine, which is often the color that frightens people most. Seeing red or pink in the toilet bowl immediately makes most people think something is terribly wrong inside. The good news is that there are several completely harmless explanations for this color change in urine. Eating beets is one of the most common causes of pink or red urine in healthy people. Blueberries and rhubarb can also temporarily shift urine color toward pink, red, or even a purplish tone. The antibiotic rifampin is another well-documented medication that can turn the toilet bowl a striking red shade. If you have recently started a new medication or eaten these foods, there is likely nothing to worry about. However, if your diet and medications do not explain the red color, you may be seeing blood. Blood in the urine is called hematuria, and it requires medical attention regardless of whether it causes pain. Common causes of hematuria include urinary tract infections, kidney stones, bladder conditions, and other urinary tract problems. Dr. Badani specifically notes that a dark burgundy or wine-like red color is a clear blood signal. That dark, deep red shade means blood needs to be medically investigated without any delay or hesitation whatsoever. Sometimes people see red in the toilet and assume it came from the urine without confirming that. It could also come from wiping too hard, a small cut, or another, completely unrelated external source. But if the color is consistently there in the urine itself, do not ignore it. Or wait. Make an appointment with your doctor quickly. Describe exactly what you saw and get properly tested and evaluated. Now let us cover a urine color that looks absolutely terrifying but is almost always completely harmless in reality. Blue or green urine genuinely looks alarming the first time someone sees it appear in their toilet bowl. However, in most cases, the explanation is surprisingly simple and has nothing to do with a serious illness. Food dyes found in artificially colored candies, drinks, or processed foods are one of the most frequent causes. Asparagus is another common culprit. It can lend urine a faint green tint, along with its well-known smell. Several medications, including certain heartburn reducers, antidepressants, and muscle relaxants, can also shift urine toward blue or green. On the medical side, a bacterial infection caused by Pseudomonas aeruginosa can produce distinctly greenish urine in patients. This infection usually comes with other symptoms, like a strong odor, burning sensation, fever, and discomfort during urination. Certain fungal and yeast infections can also cause urine to develop a greenish hue in some cases. In very rare situations, blue or green urine can indicate a genetic condition called familial hypercalciuric hypercalcemia. This disorder affects how the body regulates calcium and requires specific genetic testing and medical management to confirm. If you see blue or green urine and you have other symptoms present, consult your healthcare provider soon. If there are no other symptoms and you recently ate something colorful, it will likely resolve on its own. Now let us add 2 important research-backed facts that most people have never heard or read about before. First, urine color as a hydration measurement tool has been scientifically validated in real clinical research studies. A tool called the Armstrong Urine Color Chart ranks urine from pale at 1 to dark brown at 8. Studies published in the Journal of the American College of Nutrition confirmed this chart is a reliable hydration biomarker. Athletes, medical professionals, and researchers now use this simple visual scale to accurately assess hydration levels quickly. You do not need a lab test to know if you are hydrated. Your urine color tells you directly. Second, if you take high-dose B vitamin supplements, do not be alarmed by bright neon yellow urine afterward. High doses of riboflavin, also known as vitamin B2, are rapidly excreted directly through your kidneys into urine. This gives urine a vivid, almost fluorescent yellow appearance that can look very different from ordinary urine color. It is completely harmless and simply means your body is clearing the excess vitamin it does not need. Many people panic after starting a multivitamin and seeing this striking color. Now you know there is nothing wrong. One final and very important point before we wrap up this entire discussion about urine color and your health. Dr. Badani strongly advises against searching your urine color on Google and trying to self-diagnose from results. Urine color alone is not specific enough to give you a reliable diagnosis of what is happening inside. Internet searches will show you a long list of frightening possibilities that may have nothing to do with you. If you have other symptoms alongside a color change, that is when you should contact a healthcare professional. If it is just a normal variation between pale and yellow throughout the day, that is completely normal behavior. Morning urine is almost always darker because you have not been drinking fluids for several hours overnight while sleeping. Evening urine tends to be lighter if you have been drinking steadily and consistently throughout the entire day. These natural daily variations are completely normal and do not mean anything is wrong with your body at all. The key takeaway from everything we covered today is actually very straightforward and easy to remember going forward. A healthy, pale yellow urine means your body is balanced, your kidneys are working, and you are well hydrated. Dark yellow means drink more water. Brown means see a doctor. Red means investigate it without unnecessary delay. Blue or green is usually harmless. Bright neon yellow after vitamins is completely normal and nothing to fear. Your body communicates with you every single day through signals like these. Learning to read them is truly powerful. If something does not look right and it continues for more than a day or two, act on it. Do not ignore persistent color changes, especially when they come alongside pain, fever, weakness, or other noticeable symptoms. Your kidneys work incredibly hard every single day to keep you alive and functioning at your best level. Give them the water and attention they deserve, and they will continue to serve you well for life. If you found this information genuinely useful and eye-opening, please take a second and hit that like button now. It helps more people find this content exactly when they need it most and are searching for real answers. Subscribe to Real Health Logic so you never miss another video packed with evidence-based health insights like this one. Your body is always talking to you. We are here to help you understand exactly what it is saying.